So fat can have a big impact, and there's a big correlation between fat and sleep apnea. Males, and you can see neck circumferences, I put it in centimeters, I think it's supposed to be 16 inches, 17 inches. And those are simple things that a physician is going to tell you. When you come and say, okay, let me measure your neck, males, females, the older you are, the more prone to have sleep apnea, obstructive sleep apnea. So age is also a feature. They'll be saying that probably some genetic markers, like if your parents had it, you might have it, but we don't know yet. We didn't go that far to conclusively say that, oh, if your parents had it. My parents are 70, but by the time when they're supposed to be diagnosed, there was no diagnostic at that time. Also, there are these features. Not everybody that has sleep apnea is obese. So you have these type of, I gave you this example of retrognathia, like the jaw inside in, instead of being normal. All of these, it's closing that airway, the upper airway, pushing toward. Or you have bigger tongues. There are people with big tongues that have to have surgery because you have big tongue that will most likely close the apnea, the airway at night. So everything morphologically that can change will predispose the thin guys. Yes?
What do they do with the surgery with the big tongue?
They cut it. Oh yeah, they cut the tongue, they make it forward.
Really?
Yes. Inside, like people with this abnormality, they cut into their jaws. They create all these dental devices just to make sure they reposition the cranial features back to normal, so you can open up that airway. So all of these are happening. So you don't have to think, young, pretty lady, skin, you're not going to have it. They can have it too. So it doesn't matter. Couple of consequences, simple consequences. A lot of people complain of snoring, sleepiness. That's the basic. You know, you're not going to know unless you have a partner that can help you being sleeping, you being stopped breathing. Or you yourself, you can complain of sleepiness during the day. You have all of these things that they're not a great deal. Oh, the memory is kind of giving me some issues. I'm not able to cognitively understand a lot of stuff. Some people are not concerned with that. It happens. I was really tired. Also, you go to the metabolic derangements. It's been linked to diabetes. A lot of patients that have diabetes actually have sleep apnea as well. Okay, so a lot of things, if I tell you you have sleep apnea and you will have these issues, I don't care that much. What? I'll snore and I'll feel tired during the day. I'll catch up with sleep tomorrow. I'll sleep in the weekend a little bit more. So, yeah, quality of life can be affected. Oh, I don't know, probably because of, I have a fight with my wife. Probably that's something else going on. Not a disease per se, okay, when I hear a lot of these. But when I hear about sleep apnea being connected to hypertension, that can spark some interest. And for sure, a multitude of research is showing this, that patients who would always say have a threefold increased chance of developing hypertension. And recently, starting 2010, the cardiology association of all these physicians, cardiologists, is telling them, hey, if you have a patient with hypertension and is not responding to the medication, immediately send them for a sleep study. So they recognize it, and they told every cardiologist, this is the #1 culprit that you should look for, sleep apnea, when you can find anything that works for those cardiac patients. And a lot of research, mostly it's linking sleep apnea with congestive heart failure, coronary heart disease, stroke. big, huge, severe cardiovascular diseases. Why? Everything starts here. You know, as soon as you start with hypertension and you're not controlling that, everything else goes down the drain. It will affect the heart, it will affect everything, and you go into these big, severe ones. Those were two information about two big studies. I just want to show you the magnitude of these studies. Like in 1991, they started this study when they have every public employee in Wisconsin, or whatever county was that, and they've been following those up, and they saw, look, right now, what's your blood pressure? 120 over 80, 121. In 10, 15, 20, 30 years, their blood pressure went up. Why? They look and see, you have sleep apnea. Yes, 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 yes. So everybody with sleep apnea and blood pressure was a direct correlation, a direct link between presence of sleep apnea now and 10, 15, 20, 30 years. Another 6,000 patients were studied, and they saw the same thing. Regardless of everything, regardless of being obese, regardless of being male, regardless of smoking, sleep apnea was the one that triggered hypertension. A couple of other things, cardiac dysrhythmias. So a lot of people with sleep apnea, for sure, we're going to start having atrial fibrillation, retroventricular contractions, ventricular tachycardias in old age. This is the big thing. This is where everything starts. Endothelial dysfunction. These are the level of the chemistry of your blood vessels. If you have sleep apnea, these are changes that are happening at the molecular level. And as soon as these happen, there's nothing you can do. You know, it's like, what, it was Easter a couple of weeks ago. When you do that dye and you put the dye into a little water, the water is going to get blue. There's nothing you can do. The chemicals inside made that water blue. Can you undo it? I don't know how. Same thing here. As soon as those molecules start working and changing the endothelium, the endothelium actually is the cell, it's it's a single layer of cells in a blood vessels. So you see the tubes of your vessels inside, right before they touch the blood itself, there's a single layer of cells. That's the endothelium. As soon as that one gets damaged, there's nothing you can do. And that will trigger something else, hypertension, congestive heart failure, coronary artery disease, all that. So research is showing at the molecular level sleep apnea having an impact. Cardiac hypertrophy, heart getting bigger, this leading to congestive heart failure, and so forth. Again, big issue. As soon as the sleep apnea has been diagnosed, most likely patients would, and not treated. If you leave sleep apnea untreated, this is where everything's going to end. And morbidity, mortality. Severe, associated with threefold higher risk of cardiovascular events than people without, or people that are treated with whatever treatment is. We'll talk in a little bit. So it's fine. You have sleep apnea. I got somebody with sleep apnea. It's okay, but let's treat it. Let's go for the next step. If you leave it untreated, all of these will happen. I don't know, soon or later will happen. Yes?
Sounds like you're saying a lot of these things that are treated with meds, you use the CPAP machine, you wouldn't need the meds.
Yes, I'll touch that point in a little bit. Exactly. Because we're talking now of comorbidities. Like I had something and I have sleep apnea on top of it. And research has been showing if I treat the sleep apnea, like the example with hypertensive medications, I'm taking these, three pills, blood pressure still 140 over 92. I'm putting you on a treatment. Oh, you might take just 2 medications in a month, and probably in a half a year, probably just 1 medication to keep it at 130 blood pressure, systolic blood pressure. So as an adjunct treatment, sleep apnea is being promoted and is being advertised. The problem is it's still catching up with all the other specialties. endocrinologist, cardiovascular, like cardiologist, is still catching up with them. They're starting recognizing, and as you can see, they say, okay, go for the sleep side, go for the sleep side. They keep telling it, but they should start early, as soon as they see some of those features. And again, prevalence. Angina, people that just experience an angina, 30% of them have sleep apnea. Those, I was talking about the blood pressure, high blood pressure that does not respond to medication, 80% of those patients have sleep apnea. And then you can go in between stroke, congestive heart failure, all type of blood pressure. Half of those people, they have sleep apnea. We'll be talking about those major ones: diabetes, coronary heart disease, stroke, all of those cardiovascular problems. Also, you have all of these too: daytime sleepiness, decreased intellect, behavioral personality changes. These are not as striking for population like us, but for example, for students, for people that are, because young people can have sleep apnea as well. I had a study which we tested patients that were admitted at Virginia Tech, so they were between 18 and 22 probably, undergraduate students. And we find out, I think, around 20% of them had sleep apnea. And it was not like they were, really obese or they were old or, no, they had it. So because of that, a lot of these things can, memory loss, intellect, can impact, and there are studies that impact their grades, that impact their efficiency in school. Sleep apnea can happen in children. Did you know that? Children, 5, 6, 7, 8, they can have sleep apnea. But mostly it happens because of abnormality in their throat anatomy. They can have big adenoids, they can have big tonsils, and as soon as they get removed, clear out. No more sleep apnea. But it has to be recognized. You have to look, the kid is performing in school really, not really bad, but with some hardship, is not able to focus in class, he's kind of dozy and stuff. You should suspect. You never know. Most likely the physician is going to look for abnormality first in kids. And very easily, go snip, snip, done. It's treated. Because mostly of these things.